Can remote monitoring improve, quicken, or enhance orthodontic clinical practice? Welcome to this episode of Orthodontics in Summary. Now, today's episode is looking at remote monitoring. It is based on an excellent debated lecture between Juan Varela and Jonathan Sandler as part of the AngleNet webinar series. Now, to start off with, what is dental monitoring? Well, it is an AI proprietary software which assess occlusal and dental changes through a series of intra-oral photographs taken by the patient using their own smartphone and a holder termed a scan box. Now, the way the software works is that it takes an STL digital study model of the patient, photographs are taken, and the AI maps the photos to that digital study model. Subsequent photos are then able to assess dental and occlusal changes taking place to the patient remotely. Now, dental monitoring is mainly used with aligners and can look at the fit of the aligner. This analysis allows a good fit for patient to proceed to the next aligner. If it doesn't, a series of automation takes place to increase wear of the actual aligner or to schedule an appointment back with their clinician. It can also be used for fixed appliances and looks at the rate of dental movements taking place, and therefore appointments can be scheduled when appropriate and not just in arbitrary intervals. Other proposed advantages are looking at oral hygiene, breakages, and also changes during retention. The proposed advantages of this remote process from a clinical side are that it can, 1, reduce the number of appointments patients have, 2, it can reduce overall duration, and 3, more effective clinical decision making. So looking at how patients perceive this idea of having remote monitoring, well, this was D'Alessandri's 2021 study, where he showed 4 out of 5 patients are interested in having remote monitoring if it reduces the quantity of appointments they have for their dental management. However, in Hunter's 2020 paper, they showed that actually 1 in 4 patients can struggle to perform these intraoral photographs through the scan box, and the duration varies. Some can do it in 2 minutes, others it takes 17 minutes for them to perform this task. So the main question, does it reduce the number of appointments that patients need? Well, fortunately, we've got Sangali's systematic review just from last year. They looked at 11 studies of varying quality and found, yes, it does reduce the number of appointments, between 1.5 and 3.5 appointments. However, they also found the overall duration of treatment was not changed and is as normal as conventional appointments are. Also, no statistical difference when it came to emergency appointments. We probably wouldn't expect it to make any difference to those emergencies. Are clinical outcomes better with remote monitoring? This was an excellent study carried out by Hunter in 2021, where they looked at aligner patients, the movements that were predicted, and also the clinical movements that took place, and showed between both of the remote monitoring groups and conventional appointments, there was no difference in the clinical outcomes of tooth movement. Once more, they found there was no difference in the rate of refinements either that took place. What we understand is that remote monitoring doesn't seem to be changing clinical decision making. Gerard Marks looked at the quality of outcomes using PAR and showed there was no difference when patients with aligners were remotely monitored versus seen in clinic. Shout out to Gerard Marks, a resident from Australia who I had some dealings with when it's come to teaching. How accurate is digital and remote monitoring? Well, Ferlito's study from 2022 explored this with dental monitoring, and they found that there is 80% repeatable scans are reliable. However, that number drops down to 44% when we consider the reproducibility, i.e. a similar discrepancy in another patient. What we also can see from looking at intra-oral scans to the information given from the photographs and the scan boxes, there is a discrepancy. When we quantify it, it can be anywhere between 0.5 millimeters all the way to 1.9 millimeters, and angular errors can be up to 9 degrees. When it comes to oral health, there does seem to be a significant improvement through the remote monitoring process, and this was Manzar's study which showed a 31% improvement in oral hygiene for patients. There's other innovations around remote monitoring, the ability to create an STL file from these photographs taken with a scan box, and therefore allowing refinement aligners to be created without a clinical appointment being required. This is Juan Carlos's research project. We're still waiting to see the evidence on this. Overall, remote monitoring does reduce the number of appointments by 2 to 3. There is no difference between the overall duration of treatment of patients. And although most patients are able to do so, some patients, 1 in 4, may struggle to use the actual process. However, the accuracy and reproducibility seems to be an issue when compared to clinical measurements. There is also no difference in the quality of the outcome of measures of patients with remote monitoring compared to in clinical management. Jonathan Sandler also raised some other concerns, that there may be other measurements we want to see in clinic of our patients, the occlusal assessments, and for that we need a reliable, reproducible contact position for that assessment. We can also build rapport with patients when they come to in-clinical appointments. We may not be able to do that when we're remotely assessing patients. He also mentioned the occlusal photo is not taken using a mirror, and therefore the assessment may not be a good one to use. There's also environmental costs through this process of using remote monitoring. He described how now cloud data occupies 2 to 3% of all the energy used in the world. And he also mentioned other ideas to reduce treatment duration, and that is good old diagnostic and clinical acumen, focusing on the greatest features of malocclusion and being reliable in reassessing them on each appointment, which may overall remain the biggest factor to the efficiencies of our treatment. That brings us to the end of this episode of Orthodontics in Summary. We've got an IPR course coming up next week in Manchester, which we're excited for, and hopefully launching in the next few months our IPR online course. Please do subscribe and look forward to seeing you in the next episode.